It's one of those moments that's pretty much every parent's worst nightmare. Your child is sick with a fever, and then, out of nowhere, their body starts to shake. It's terrifying, and it's so easy to feel completely helpless. So today, we're going to cut right through that fear with some clear, calm information, pulled directly from medical experts to help you understand what's really happening.
Just picture it for a second. Your little one who you were just trying to make comfortable suddenly goes rigid. Maybe their eyes roll back, their limbs start to jerk, and your mind just races through 100 different worst-case scenarios. So what is actually going on in that moment?
Well, that absolutely terrifying event has a name. And maybe the most important thing to know right off the bat is that it is way more common than you'd ever think. If this has happened to you, trust me, you are not the first, and you are definitely not alone.
What you've almost certainly witnessed is something called a febrile seizure. So let's just break that down. First, it happens in young kids. We're talking from about 6 months to 6 years old. And the key part, the absolute most important part, is that it's triggered by the fever. It is not caused by some kind of dangerous brain infection like meningitis.
So how common are we talking? Well, somewhere between 2 and 5% of all kids will have at least one of these. To put that in perspective, right, if you imagine 100 kids running around a playground, that means 2, 3, maybe even 5 of them will experience this at some point. In the world of pediatrics, this is a really well-known thing.
In fact, it's not just common, it is the single most common neurological event for little kids. It happens most often right in that sweet spot between 12 and 18 months old. So you can see why, even though it's incredibly unsettling for you as a parent, for a pediatrician, it's a pretty familiar scenario.
Okay, so that leads us to the next really big question. Why? Why does this even happen? What's the link between a simple fever and something as dramatic as a seizure in a little kid's brain?
You know, what's fascinating is that doctors don't have one single perfect answer. The leading theory, though, is that a young child's brain is still under construction. The wiring isn't all insulated yet, so to speak. So when you add the stress of a high fever into the mix, all those electrical signals in the brain can get a little overexcited, and that excitement can just tip the scales into a seizure.
So what kinds of sicknesses bring on these fevers? Well, it's usually the same old bugs that are just part of being a kid. We're talking about things like colds and the flu, ear infections, tummy bugs, the usual suspects. So it helps you connect the dots, right? The seizure didn't come out of nowhere, it came with an illness.
And yeah, those common viruses are the main culprit. A full 80% of febrile seizures are tied to a viral infection. But there's another piece to this puzzle. In about a third of all cases, there's a family history of febrile seizures, which tells us that our genes can play a role too, making some kids a little more likely to have one.
Okay, this next part is really important because it helps us understand what happens after the seizure. See, not all febrile seizures are the same. They basically fall into 2 buckets, simple and complex. And knowing which is super important for doctors.
So a simple seizure, which is the most common kind, by the way, lasts for less than 15 minutes. The shaking involves the whole body, and it only happens once in a 24-hour period. A seizure gets the label complex if it breaks any one of those rules. So if it goes on for longer than 15 minutes, or if it seems to start in just one part of the body, or if it happens more than once during the same sickness.
All right, let's shift gears from understanding what it is to what you should actually do. Because knowing what to do in that moment can give you back a sense of control when things feel chaotic. So let's walk through the steps, one by one.
Okay, number 1, and I know it's hard, try to stay calm. Get your child down onto a soft surface, like the floor, away from any hard furniture. Gently roll them onto their side. This just helps keep their airway open. Now, this is critical. Do not try to hold them down, and do not put anything in their mouth. The next thing, and it's so important, is to time it. Look at your phone or a clock the second it starts. That duration is one of the most vital pieces of information you can give a doctor later.
And the reason that timing is so crucial is because of this guideline. The medical advice is crystal clear. Any seizure that goes on for longer than 5 minutes needs emergency medical help. It's unlikely to stop on its own at that point. So if you hit that 5-minute mark, it is time to call for an ambulance.
Now, here's a question that pretty much every parent asks. Could I have stopped this if I'd just given them Tylenol or Motrin sooner? And the answer, very clearly, is no. Look, fever reducers are great for making your child feel more comfortable, but studies showed they do not prevent febrile seizures. So go ahead and use them for comfort, but don't ever feel guilty that you didn't prevent the seizure. So, after the seizure is over and your heart starts beating normally again, the what-if questions start to creep in. And these are the long-term worries that can cause some real anxiety. So let's just tackle the two biggest ones head-on and see what the data actually says.
This is it, right? This is the first question on your mind. Was that a terrifying one-time freak event? Or is this our new normal, every time my kid gets sick?
And honestly, the odds are really reassuring. For the majority of kids, a full 2/3 of them, a febrile seizure is a one-and-done event. It never happens again. For the other 1/3, yeah, it might happen again, but even then, it's something that will eventually and completely outgrow.
And now for the big one. The word seizure just automatically makes us think of epilepsy. It's an understandable connection. So does having a febrile seizure mean a child now has epilepsy?
And for the vast, vast majority of kids, the answer is a resounding no. The risk of a child developing epilepsy after a simple febrile seizure is incredibly low. We're talking only about 2 to 7%. That means up to 98% of kids who go through this will not develop epilepsy. The risk is a little bit higher for those complex seizures, but even then, it is still very, very small. So, you might be wondering, who falls into that slightly higher risk group? Well, the experts point to 3 main things. Having a family history of epilepsy itself, not just febrile seizures. Or if a seizure was complex and focal, meaning it started in one specific area of the body. Or if the child had a pre-existing developmental delay. Those are the specific flags that doctors look for.
So here's the bottom line. A febrile seizure is an incredibly scary thing to watch as a parent. Nothing can change that, but those terrifying few minutes do not have to define your child's future. It's a common, and in almost all cases, totally harmless reaction of a young, developing brain to a fever. And understanding what it is and what it isn't is truly the most powerful tool you have to replace that fear with facts and confidence.